All right, in this lesson, we're going to take a look at cardiac physiology and the factors that affect cardiac output. When we're talking about cardiac physiology, we're talking specifically about this guy right here, cardiac output. So cardiac output is the volume of blood that's going to be pumped from that left ventricle to the aorta per minute. And what we do is we look at this formula here, and this is going to tell us more information about how we get cardiac output. First off, we look at a couple of factors. First off is heart rate. So this is going to be heart rate done in beats per minute. And we're going to multiply that times the stroke volume. And what stroke volume is it's the amount of blood squeezed out by the ventricles in each contraction. And this is done in mils per contraction. So basically it's heart rate times stroke volume, and that's going to give you your cardiac output. And the way we look at this is in liters per minute. So the average normal range is going to be about 4 to 8 liters per minute of cardiac output. So let's say the average is about 6. So this is how we use this formula. So you get 75 beats per minute, that's your heart rate, and it's going to be 80 mils per contraction. And so basically you're going to get this output of 6,000 mils or 6 liters per minute. Now, a fun fact about this is that the average cardiac output during exercise is about 30 liters per minute. And one other thing that we need to look at is this thing called cardiac reserve. And basically, when we go from a normal heart rate to like the fight or flight response, basically it's the ability in it's the difference in the heart's normal ability to pump and then its maximum capacity. So if we're looking at, hey, we have to go from normal heart rate and all of a sudden we get really excited and we have to go do some sort of strenuous activity, it's the ability for the heart to go from that normal ability to pump and its maximum capacity. This becomes a problem with people that aren't physically fit. They can't keep up with that response. So the higher the cardiac reserve, the more physically fit a person is. It's that indication. When we're talking about cardiac output, we're also going to look at this thing called Starling's law. And what happens with Starling's law is that as there's an increased volume in the ventricle, so let's say we start to get more volume back in, it's going to create more volume in those ventricles and it's going to stretch that myocardium out. As that myocardium gets stretched, it's going to force a stronger contraction. So you're going to get an increased stroke volume. And at some point, whenever we talk about getting more blood back from venous return, there's going to be a point where even if you hit that maximum point of venous return, it's not going to increase that greater stroke volume. Now let's take a look at the nervous system control. So this is how input into the heart works. And this is from the nervous system. So you've got two pathways. You've got the parasympathetic and you've got the sympathetic. Parasympathetic is rest and digest. And what we do is, in this instance, you have something called vagal tone. And this vagal tone is going to allow the heart to remain at rest. And when you have the sympathetic input, this is your fight or flight response. And what happens is there's two innervations. You've got, this is from the vagus nerve and this is from the parasympathetic is from the vagus nerve. And then the sympathetic is going to be from the T1 through T6 spinal nerves. And when we look at these two, we've got two different types of neurotransmitters that are going to stimulate the response. So when we're talking about parasympathetic, this is acetylcholine. And what acetylcholine does is it's going to be responsible for pushing out those action potentials at a certain rate. The innervations here are from the right vagus nerve is going to be into the SA node, and then the left vagus node left vagus input is going to be to that the atrioventricular node and to the ventricles. When we talk about the sympathetic response, this is norepinephrine. This is going to be the one that's going to increase the heart rate. It's going to increase blood pressure, and this innervation is going to be at that sinoatrial node and the atrioventricular node. And then you're also going to have some innervation in the atrial and ventricular myocardium. So the human body is extremely fascinating, and it has a great ability to compensate. And when we look at mechanisms of action, what we want to do is we're talking about how the body responds to a particular change. So let me kind of explain how this works. When we're talking about cardiac output, we're talking about what does the heart do in response to, let's say, different things from the body. Well, the heart can increase or decrease the heart rate, or it can increase or decrease the stroke volume. And with disease, what the heart tries to do is to compensate. So let's say if the stroke volume is decreased, what's going to happen is the heart rate's going to increase to compensate, because we want to maintain that level of cardiac output. But let's look at different types of situations. we're going to look specifically here at heart rate. So if we have a decreased heart rate, there's going to be increased vagal input into that SA node. So there's going to be more acetylcholine. So this is a parasympathetic response. You're going to get an increase in the acetylcholine at that SA node, and that's going to decrease the rate of depolarization. Therefore, you're going to get a decreased heart rate and a decreased cardiac output. Now, there's like I said a couple slides ago, we were talking about vagal tone. This is that normal supply of acetylcholine at rest, and we want to keep that heart rate normal. So the body's response is that we're going to get this parasympathetic input to get the acetylcholine at about 70 to 80 beats per minute. And when we're talking about increased heart rate, we're going to increase that sympathetic input. This is going to be an increase in the norepinephrine at the sinoatrial node. It's going to increase the rate of depolarization. So this is going to be an increase in action potentials per minute. And that's going to cause an increase in heart rate and going to cause an increase in cardiac output. Because remember, you got heart rate times stroke volume. That's going to equal your cardiac output. So even if this maintains normal, your stroke volume stays normal, and you increase the heart rate, you're going to have this increase in that cardiac output. So what happens when we're talking about stroke volume? Well, it's really similar to the heart rate, but it works a little bit different. So when we're talking about decreased stroke volume, this is going to be an increased parasympathetic input into the ventricular myocardium. So you're going to have a slightly decreased force of contraction. So your contraction is actually going to go down. It's just going to be the force. So like we talked about, heart rate times stroke volume equals cardiac output. So if this maintains normal, you're going to have a decrease in stroke volume. You're going to have this decrease in cardiac output. Adversely, when you have an increased stroke volume, you're going to get increased sympathetic stimulation. And that's going to be specifically to the atrium and the myocardium. You're going to get the increased force of contraction. And if we go back to our formula, you have about a normal heart rate, and you're going to increase the stroke volume, and that's going to increase your cardiac output. Okay, so let's recap. Anytime you're dealing with cardiac physiology, you have to remember this equation. You got your heart rate times stroke volume, and that's going to equal your cardiac output. Your vagal tone is that normal acetylcholine to go 70 to 80 beats per minute. And acetylcholine slows down the heart rate. When you have the sympathetic input, that's going to increase the heart rate, and that's going to be due to the norepinephrine. And then you have these compensatory actions. The heart's going to compensate to maintain that normal cardiac output. So you've got your heart rate times stroke volume, and that's going to have your cardiac output, and you want to maintain that at about 6 liters per minute. So let's say your heart rate goes down, well, your stroke volume is going to compensate to make sure that this thing stays about normal. That's it for our lesson on cardiac physiology. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.